Good morning, everyone. We are going to talk today about uterine inversion. We'll study the definition, classification, the etiology and risk factors, the clinical features, complication, and management of uterine inversion. So, starting with the definition, it is defined as the fundus of the uterus turning inside out, either partially or completely, following delivery of the baby, and it can lead to postpartum hemorrhage and shock. And the classification is first degree, second degree, third degree. As you can see in the image, the first degree is the fundus has dimpled, but it is above the internal os. In the second degree, it has gone below the internal os, but is still inside the vagina. In the third degree, it is completely outside the vagina. And the difference between uterine inversion and prolapse is you can see the internal loss in prolapse, but here the internal loss will not be visible. Coming to the etiology and risk factors. Risk factors can be weak uterine musculature, uterine overdistension due to polyhydramnios multiple pregnancies. Some iatrogenic causes can be like excessive traction given to the cord when the uterus was atonic, or some faulty fundal pressure was given. And some other placental factors can be morbid adherent placenta. These can be the causes. Now, coming to the clinical presentation, the mother will present as acute lower abdominal pain with bearing down sensation, and if the hemorrhage is started, she can go into severe postpartum hemorrhage. And due to the irritations of the nerve, she can also go into neurogenic shock because of the stretching of the infundibulopelvic ligament. So these are the danger sign. Other signs can be like on abdominal examination, you can find dimpling of the fundal surface. Now coming to the complications, as mentioned earlier, PPH, shock, infections, even risk of thromboembolism can be there. Now coming to the management. In management, we follow three steps. First, the hemodynamic stabilization, the ABC part, followed by it we reposition the uterus. In reposition, first we try the manual replacement, which is the Johnson's maneuver. We try to manually push the fundus upward towards the vaginal canal. If it's failed, we try the hydrostatic method, also known as O'Sullivan method, where we instill warm saline into the vaginal canal to create hydrostatic pressure. That pushes the uterus back to its normal position. And if it also fails, we go for the surgical management, which is the Huntington's Huntington's procedure, where we pull the uterine walls upward using the forceps. And post replacement, we administer oxytocin, broad spectrum antibiotics, and then we remove the placenta. Placenta should never be removed when the uterus is lying outside. And for the prophylaxis, we should always give a gentle traction, proper management of the third stage of labor. If the uterus is atonic, we should use the uterine drugs. So this was all about uterine inversion. Thank you for watching.